Hello, yeah, sorry. All right, good morning, everyone. Welcome to the Psychiatry Society West Zone PG Psychiatry Education Subcommittee's Scholarly Sunday Sessions. And this is our fourth series, and we are on our second edition. Today's topic is Common Mistakes During Practical Exam Video-cum-Panel Discussion. And I would first like to invite Dr. Sushil Gawande, sir, our chairperson of the subcommittee, to please say a few.
Uh, just a minute. Thank you so much, Prajakta. First of all, very good morning to respected panelists, Dr. Hinal Shah, Madam, Dr. Sandeep Shah, sir, moderator for today's session, Dr. Prajakta, and all the office bearers of Psychiatric Society Western Zone, and all my dear students. All the best for the moderator, panelist, and all the members. And I hope next 1 hour will be very fruitful learning for all of us. Thank you so much. Over to Prajakta.
Thank you, sir. So for today's session, we have, are my slides moving? Yeah. Yep. So we have two faculty, Dr. Hinal Shah, ma'am, and she is professor and HOD at Nair Hospital, Mumbai. And Dr. Sandeep Shah, sir is professor and HOD Department of Psychiatry at GMERS Medical College and Hospital at Vadodara. Welcome, sir. Welcome, ma'am.
Thank you.
So we the way we have made this panel discussion is that we've made a few videos for everyone to see, and I'm going to be playing those videos in between. The sound is a little low, but I think if you have headphones on and if the volume of your phones are good enough, you'll be able to hear it. So I would maybe first we would like to ask both the faculty members that there are most of the times students come after the papers are over, and then they ask us that how do we prepare for practical exams, and what different do we need to do when papers are over and theory is done but practicals is something completely different. So would you first start by telling them how do they prepare in that interim period between the practicals and the papers, and what do they do? Hinal, ma'am?
Yeah, sure. So I think the first thing is, what happens is that they've all taken a long break for the exams. So for about 1 or 2 months, they're away from the boards and they come back after the theory. And in that period, they have read so much theory and not presented a single case. So I think the first thing is to get back to what is your normal routine of presenting cases. So come and present cases. Don't, because what happens, you start talking esoteric stuff which you've suddenly read in the theory books and you're very knowledgeable. But when you're going for practical exams, we don't really want to hear all the greatest theories and the newest research. We want to check your competency. Do you have enough competency to treat common mental disorders and some complications of that? That's what you're going to start out with. So you have to know those things. So that's one thing about cases. The second thing is we also expect that you will be able to do some drugs, because there's always drugs over there. So those are the things. And when we say drugs, again, we don't want you to talk about the most esoteric side effects. What do you see and how do you use it and how do you manage? Common practical things which a person who passes out can do. Similarly, we want you to recognize CT, MRI, EEG of common disorders. Brush that up because you may have not done it for months. And I know in some cases I've never done it. So it's time to really think about it, and should have thought about it much earlier than just now. And psychological tests, which we may ask. MUHS is now, or MMC has also, NMC has now introduced thesis. So please brush up your thesis. There's 20 marks for thesis where you're going to be questioned. So you have to have some idea about that also. I'll hand it over to Sandeep to say something more.
Yeah, good morning, everyone. Madam has nicely summarized what you should do between theory and practicals. And the biggest part which we see missing is refreshing on the presentation of the cases, the sequence of how you should present a history, how you can build up your history to reach to a diagnosis, and then from that diagnosis to treatment. What the responsibility of the examiners, of the guides, of people who have been grooming the PGs, and what they review is how the person is going to be having the capacity to go out and treat people who have one or the other mental health issue. And managing anybody with mental health issue includes everything, diagnosing, treating, knowing about the common problems, knowing about the comorbidities, knowing about the diagnostic formulations. And the basics should be right, like Madam told, we are not looking at the drugs in the pipeline as the evaluative things. We are looking at the commonest possible drugs, the commonest things which we should be doing, and the therapeutic support which we can give them and help them with. So that is what we should look at when we are doing the practical exams. Yes. And just a brief on how they can prepare.
Thank you, sir. Thank you, ma'am. I think let's start with the first video because then we have a direction in which we can take the discussion. So this is generally about the behavior in the examination room by the students. And we have this video. I'm going to play it now.
Prajakta, we are not able to hear.
It's not audible, sir?
No.
It's not audible.
I think you've not, just see if you've enabled your audio over there when you share.
Yogendra, can we help?
Sir, I think if you run separately, that will help.
That is good.
Separately as in? Yogendra, what does separately mean?
I think you have embedded in the PPT, no? PowerPoint, no?
Yes.
So there is a file, MP4 file. Separately you run and then share the screen.
Maybe you can let Yogendra only do it, so it will be simpler.
Prajakta, close this. Open in your file video and then share the screen.
Then share the screen.
Okay, one second. Maybe till I figure out the videos, if ma'am and sir can talk to the students about what how do they generally need to behave in the examination room, maybe mostly with the examiners because they are new people and they might seem a little dangerous to them because they've never seen them before. So what do you feel, how should they be?
So, okay, I'll start. We go around telling the world to be relaxed during the exam. I think most of the big jobs that we do is during all exams prevent suicide and teach people to be relaxed. We should imbibe some of that. All right. I know it is stressful, but use some of that medicine, that psychiatry that you have learned for yourself. So learn to be more relaxed. Nobody is out to fail you. Everybody is out to pass you because we all believe that all teachers are working well to train you and that you will be able to reproduce that. So go with the idea that they want to look at what is the best in you, not as the worst in you. I think, and that applies for 99% of the teachers. You may have a stray one examiner, but remember there are 4 examiners. Even if there's one person who's stray, there are 3 others who are balancing it. So go with the attitude that whatever I've done in the last 3 years is going to help me. So go with decreased anxiety, good confidence, no overconfidence also, and go with pleasant attitude, smile at everybody, look at everybody. Don't just look at your internal examiner and be glued to them, and ignore all the other examiners. I understand it gives you comfort, but the other examiners will switch off and not listen to you. What do you say, Dr. Sandeep?
Yeah, I think Dr. Prajakta used the word dangerous, but no, it is not like that. Every examiner who comes has his own PG students also whom he has been grooming and seeing their exams, and is there to make you more comfortable even as external examiners. Assessing has nothing to do with, showing an attitude. Assessing is basically on the basics, and it is very important that you are all going to be assessed on the basics which correct. Good to know, you must know certain things in psychiatry, and those are the things which will sail you through. If you get stuck at one point, if you don't know something, you should be wise enough to say that I don't know this, I'm sorry. And that is enough. I mean, it is not expect that everybody would know everything. Even for us, it is not possible. So important thing for you is going to make it, the attitude is very important. The more anxiety shows, it is not that it is just showing, but also that it is affecting your performance. So see that we can handle it. I think the video has now come. Let us see if we can have the sound.
Yes, I'll just play this video.
Sound is not there.
It's not audible.
No.
I think the basic sound is very good.
Okay, all right. So I'll just say what maybe is we were trying to show in this video. In this video, there is this.
Prajakta, shall I ask Romesh to share from his end?
Okay, yes, sir.
Ha. Yes, you can go ahead. Romesh, ha. Arey, videos are not getting played.
Right. But till then, so in this particular video, this student comes in and he is trying to read his case, and he makes a few mistakes in the initial, like he says male instead of female. Then he says something. He makes like very silly mistakes, and then he gets very, very anxious. And that happens to a lot of us, when the examiners are new and it's an exam setting. Sometimes we make those initial very silly mistakes in the beginning, and then you get very anxious. So what do we do then?
So I think one of the things to realize that examiners are not augurs. We may appear strict and things like that. And we also have been in that same chair many years ago. So we also have gone through anxiety. But the idea is even if you start with anxiety, at least once you see that the examiners are not doing anything, you can gain your balance. That is what is important. Not to think about, okay, I made a mistake and now everything is gone. Stop catastrophizing over there also. So, relax, have a look, see that the examiners are smiling at you. And even if you have, made a few mistakes, you can just take a deep breath. And most examiners will say, okay, cool down, have some water. So they will do those kind of things. Take that cue, take a moment to gather yourself and start again. Mistakes are allowed. I mean, you're not perfect, otherwise you wouldn't be a student.
So I think the audio did not play in that video. It's been well done. And it is important to understand from that video when the student tries to start talking about the history. It's important to talk, wish each other, wish the examiners. And then when you are starting to present, if you make a mistake of calling a male a female or either other way around, you can still go back, correct it, take your time to get into reading the history, narrating the history, and then you can pick up the speed. So it is all right, if you have made a mistake in reading what you have written, because you have taken enough time in a long case to write a history. So it is possible in those anxious moments in the beginning that you will have certain places where you may misread things. But that is all right. Even the examiners understand that. So that's not a problem to increase or the reason to increase anxiety. It is important to understand that you have taken time to take the history, written down the history properly, and this is your beginning of how you are going to narrate it. So narrate it, go back, correct what you have not read correctly, and go ahead. So that will make things more easier even for you, because just calling a male a female doesn't do anything in the history. So that should not be a big cause of concern, right?
Also, sometimes the students who do, if
Yogendra,
I make a big mistake in the beginning, is the whole viva going to go bad, or am I going to ruin most of it then later on?
No,
It's no, sorry, ma'am. Yes.
go ahead, go ahead.
No, it's not usually like that, that in the beginning only a person is, it's an impression which you start with, but you are always rated on the whole exam and not how you begin with. So there are times when you may not do very well in the first few minutes of your narration, and you have a whole day of examination. It is not only one thing which you are presenting. Sometimes we should see that we should be flexible enough, talk, say that we have missed certain things, certain omissions. If they are pointed out, we can also discuss that out, because examiners are also looking at critical thinking which has developed in you in these 3 years of training, and not only just what you are reading out from your paper. So sometimes what I have seen commonly is that the student just reads out whatever he has written in 40 minutes. And it's easier to, like Dr. Prajakta told in the beginning, that eye to eye contact can be maintained because it is not something which you have memorized, it is something which you have just taken as history. So if you can sometimes maintain eye to eye contact while reading the history and narrate the origin, duration, progress of the present history in a proper manner chronologically, then things should start flowing properly.
And if I'd like to add, to me, it also reflects how much you worked in the ward. Because eventually, we know that, and we've seen that over the years, that students who usually pass and do well are the ones who have worked sincerely in the wards. So if you have worked well, it reflects in your history, because you will be more used to presenting it well, writing it well. And if you have been presenting it in your OPDs, your clinics, and things like that, then you will automatically, in the rounds you have done it so often, it will come with a flow. Yes, anxiety may mar a bit of it, but if it is so well entrenched, practice makes perfection. So over the 3 years, if you have done it the right way all those years, then no matter how anxious you are, you will not fail. You may make a few mistakes. And remember, MUHS has given us a mandate that we have a format, so that we have marks on different parts of it, including your communication. So remember, now this time there are 5 marks for your communication with the patient, communication with the examiners. So we are looking at all of that. So you can't just, if you start badly, cannot fail, because there is a set and there are 4 people. So it's not easy to fail you. In fact, it's difficult to fail. There are papers written why students are not failing even if they should. So it's more skewed to passing than failing.
Madam,
am
I
I
have
audible to you, Prajakta?
hello,
Yes,
Sachin sir.
Huh.
I have the video now. I will play
Huh.
it.
Yogendra has a video he can play from his end. Prajakta, can we have first video?
yeah. Can I just try once and see if this works?
Nee, he has. He will share from his end. I have shared all the videos to him.
I think now sound has come.
Yeah, that's what.
Yes, ma'am. Now sound is coming.
Presenting the case of a 36-year-old lady, Miss Radha Rahangale. She came with her parents to Lata Mangeshkar Hospital casualty with the complaints of hearing voices inaudible to others, muttering to self, sleep disturbances, and poor self-care. since the past 15 days. There is no history of any such complaints previously. The patient was apparently all right 4 months back.
अरे यार थोड़ा इधर भी तो देख ले.
Sorry, sir.
Right. So, ma'am, sir, is this something that students usually do? That, someone that you're familiar with, maybe, or is your internal examiner, you tend to look at that person or you tend to focus on that person. And maybe the external examiner can get a little annoyed with that.
Go ahead, madam.
Yeah, of course, because it's very boring to sit for about 2, 3 hours, and nobody's looking at you, and you get distracted also. So you want to be engaged in the exam, and the way you're going to keep us engaged in the exam is when you have eye contact with us. Don't keep looking at one examiner. Don't keep looking at your paper. Yeah, look at the paper to get cues, but eventually you've been presenting histories in rounds. Even in rounds, you don't keep looking at the paper, and if you are looking at it in rounds at your paper, make it a habit not to, because it's time for the year ones and year two. Somebody has just said, that, oh, in OPD, we have so much time and we can present it, but what do we do over here? Well, then get used to the habit that you do. Okay, there are complex cases which are admitted. Then you will take a long time to take a history. But make it as you become a registrar, make it a habit to take histories within 40 minutes and present it. When they're complex cases, more times, but otherwise it's habit and routines that help you in the exam. So do that as a regular thing. And those who have starting practice, I mean year one, who are starting residency, make it a habit to write your history, get it corrected, because the same mistakes are going to continue till your exam, till somebody points it out. So I think it is important that after you write a history, your registrar, your SR, or your lecturer reads it, corrects it. We may correct the one when you're presenting. I may not always read your history, but get somebody to do it and correct it. And if you do this in the first year, by the time when you're in the third year, you're really good to go.
Yes, I think that is well said, because it's not about learning to write history and then present during these 15 days only. And that is what is true, and that should be taken as a cue for all those students who are here, not exam going, but the other students, so that they can start preparing in that way. Like we start preparing about the theory, like we start reading certain things at a time when, we have free time and we feel that these are not very important questions. But then the day when, we have the theory exams, we realize that, okay, the whole paper has to cover certain things which we never read or thought that these are not going to be important. In practicals, it's easier because most of the things you have been doing day in and day out. And whatever you have been presenting during your rounds, whatever cues your teachers have been giving you, your registrar is giving you, those are the things which are going to help you when you present your history in a proper manner during the exams, right? Yeah.
I think 2, 3 people have asked that when you're presenting in the exam, how many details of the case are expected? So that, it doesn't get too long also, because sometimes when the examiners say your history is too long.
I think in this case, I also read that question. It is a very good question, because what happens that when the students, they prepare and present a case in the examination, they go into so many details which would not be required in a routine history, even in a long case. It is good to know that they have taken the very fine details during the history, but it is not possible to present all those details. So they have to start understanding and presenting the relevant history. It is important what you are leading to when you are trying to add those details. See, if those details are not going to add to the substance of where you are leading to for your diagnosis, then you can ask, or you can wait for the examiner to ask you about certain details which you may not have included in the narration, but yes, definitely you have taken, and you can wait for the examiner to ask if he or she finds this relevant. So I think that way the burden of trying to finish the history in time versus too many details can be taken care of.
I may also suggest that in fact it's the other way around. Most of the time in that 40 minutes, you don't get all the history because you're anxious, a relative comes, you never get complete history. So even if you don't have the complete history, we yet understand, but you should have got the relevant history. I mean, what is important? If the person is muttering to self, then you should have checked whether it's a delusion. You would have checked whether he's alcoholic. So, all those things which are relevant to lead, as Sir said, to a diagnosis should be included and should be included in a logical flow. If you have a very, very detailed history, I sometimes wonder, have you seen the patient earlier or whether you have got more than 40 minutes? So that's also another thing that is not possible in 40 minutes, you would have so many details.
Also, I think ma'am already answered that question in chat, whether when they are presenting now, do they follow the ICD-10 or ICD-11? Because it depends from institute to institute, but uh, I think ma'am has already answered that ICD-10, I mean, knowing everything and giving your diagnosis according to ICD-10 is most important.
I think even if it is from institute to institute, students need to remember, as Madam has written very clearly, that India follows WHO guidelines and therefore we have to know ICD-10 and 11 because all our medical record systems, everything goes in with the coding of ICD-10 or 11 now. So we need to learn those and remember those. We can always quote about DSM-5 additionally because we have been reading those books. But yes, we should also be definitely knowing about ICD-10 and then now ICD-11.
Okay, thank you, sir. So maybe we can shift to the next part where it is dealing with patients in front of examiners, because sometimes the patients tell you something different when you are taking history, and then when you come in front of the examiner, it's something a little different. So we have this video. I'll just play it quickly.
In thought examination, patient reported delusion of persecution.
Okay, can you demonstrate?
Yes, ma'am. मुझे बताइए, आप जब भी बता रहे थे ना कि आपके घर के आजू बाजू के लोग आपके बारे में बातें कर रहे हैं, आपको मारने की कोशिश करते हैं।
नहीं, ऐसा नहीं है, ऐसा तो
अरे आपने बोला था ना मेरे को जब भी कि मारते हैं मुझे घर के आजू बाजू के लोग।
मारते नहीं है, ऐसा तो नहीं है, ऐसा तो नहीं बोला था।
मैं जब बात कर रहा था उनसे तब वो बोल रहे थे कि लोग उनको मारते हैं।
अब ऐसा नहीं, मतलब आप कह रहे हो तो मैंने कहा था कि ऐसा लगता है।
डॉक्टर, आपने लीडिंग क्वेश्चंस के बारे में सुना है?
नो सर, नहीं सुना सर। जो हम पूछते हैं वो पेशेंट जवाब देता है। ठीक है, जा सकते हो। थैंक यू सर।
Really, every examiner will get irritated. Every examiner will get irritated. Here it will be unanimous. Okay, because this is something you have been taught from year one, and I'm taught by everybody, taught by your registrar, taught by your SR, taught by all your faculty. There is a way to elicit history. And even if that person changes in the room, we are not going to penalize you for that because we know that patients can change histories, that people may show different things. We are not going to penalize you for that. But how you communicate and how you elicit, if it is not, these are the basics. If you make mistakes in that, I'm sorry, it's going to be tough. Over to you, Dr. Sandeep. What do you
Yes, yes, I agree. The case was demonstrated. And it is common, students try to stick to what they have read and then prove it. And that is where they get stuck because they are trying to argue with the examiners on things which the examiners can see differently. And they are actually being presented also by the patient differently. So here is what I was initially talking about, the basics, to get the basics right, like leading questions. If you have not heard of leading questions, it's a problem because that is not what an examiner can take. And in such a situation, if even you during the exams face such a situation, if you have read your CTP correctly, schizophrenia there is something which is known as variability. And in this condition, a patient may present differently during the examiner's interview rather than during when you are interviewing the patient. And you have to accept it rather than challenging it. Trying to prove it takes you to this wrong course of asking leading questions. You just accept it. Examiner is also aware about those things happening, and many a times the patients and the relatives would come out with extra details when they are presenting in presence of the examiners or when you are trying to interview them. And recent examination, I have seen patients' relatives are very fluent in English and they tend to correct you even for the months which you have talked wrong. So those things will happen. It's all right. Try to see that we present it the best possible correct history and things will be easier. Right. Go ahead.
Prajakta, you're muted.
Ma'am, do you want to add something to that? Because sometimes, like sir rightly said, you tend to get into an argument with the patient that, आपने पहले तो ये बोला था.
Never try to prove a patient wrong. Also, never try to prove an examiner wrong, even if he or she is. Please don't try to leave it. Leave it. Be wise. Okay? You don't have to be smart. Be wise. Another thing that is put over there, how should we manage long cases? So that's something between after this video, we'll come back to that question also. Okay? And congratulations, really nice videos.
Yes.
Thank you, ma'am. Thank you so much.
So the next bit is about handling choices in the examination room, because there are many times that the examiner might tell you that, okay, you tell me what do you want, what can you talk about? Maybe it's the table viva or something. So we have a couple of videos on that, and let me play that and then we can.
Hello. Good afternoon. Good afternoon. Good afternoon.
बताओ कौन सा ड्रग पढ़े हो आप? उठाओ कौन सा?
जो भी सर आप बोलो सर, कोई भी ड्रग चलेगा सर.
अरे बेटा कोई भी उठा लो जो भी आपको आता है.
नहीं मैम, मैंने सब पढ़ा है, आप जो बोलो वो.
ठीक है, सब पढ़ा है तो ये वाला बताओ.
जी मैम. टेट्रापेनेजिन.
कुछ आ रहा है?
सर कुछ नहीं, ये सर ये वाला ड्रग नहीं पढ़ा था मैंने सर.
अरे इसलिए बोला था ना, आपकी मर्जी से जो भी उठाना उठा लो, जो भी पढ़ा है आपने.
ये वाला पढ़ा था.
Invariably in exams, all examiners like to give students a choice because it cuts down the anxiety. And so we don't want to impose. So we always tell you, choose a test, choose this drug, choose a thing. Be prepared, you'll be given a choice. So in your mind, when you're going, think about 2-3 things because you don't want to hunt for it very long also, right? So there will be, think of 3 drugs that you would like to pick up. Think of 3 tests that you would like to talk about. Think of 3 things in the EG that you would like to talk about and keep that ready. Be smart and be prepared for that. Every examiner usually says, kuch bhi pick up karo. So then they will say, ask that, which is the latest articles that you have read about. Be prepared for these questions. These are questions that have been coming down since centuries, no? So think of, and you have to see now, you may not find, one drug very well, but you may not find it in that mess over there. So think of 3 or 4 things which can be easily picked up and you can.
Sir, would you like to say something? Sandeep, sir?
I think he's frozen.
Yes, he's frozen. Sushil sir, if you could, yeah, Sandeep sir is back. Yeah, sir, if you would like to add to that.
Yeah, I think students have to understand that what they have been dealing with here, it was a question of drug, but what they have been dealing with on a day-to-day basis, treating their patients, seeing those patients, treating those patients, writing the medication in the history during the IP rounds, during the OPD, what they have started becoming comfortable with, what medication. And then they have been reading about that, presenting the symposias on those medicines. So they have to know that when given a choice, they should take up an ownership to say that, okay, sir, I am very comfortable with this drug, or I know most of the things about this drug. And not to worry, because still the questions are going to be similar to whatever drug you pick up. So it is not that when you pick up a drug, the questions will be different than when an examiner is choosing a drug for you. You know, he still has an option of not showing or questioning you on that drug and questioning you on something else. So don't worry. But whenever you are given a choice, exercise it. It is a very important thing, so that you have been given a chance to showcase what you have learned and what you know about the drug, to tell the examiners during the exam that, see, I am knowing all these details about a given drug which I have chosen, and that will make an impression, and you are given a chance for it. So take that chance, right?
But sometimes it happens that the person before me is maybe given a choice and I am not given a choice. Does that mean anything? Because then it makes you feel, oh, I was not given a choice. Does that mean that, the examiner has already formed an opinion and thinks that, oh, I shouldn't be given a choice?
Not at
Uh, Carry
the
on, carry on.
examiners are bored also, no? So they also like variation. They have to, it's difficult to sit for an exam for the whole day. So, and listen to people. So you are trying different things. And as Dr. Sandeep has said, see, you may pick up clozapine, but I may go on to talk about all second generation. So where we connect also depends on, what you have presented, what you may have said, or what I think of at that moment. So it doesn't mean that you not getting a choice means we've created an impression and we are now going to, grill you on something. And if you answer well, it doesn't matter. It just doesn't matter. And even if you don't answer well, it's one subsection. It's not the general exam, complete exam. Yeah, you were saying something, Dr. Sandeep, which I
Yeah,
interrupted.
Prajakta, what I would like to add here is what you've told is very true. And that is the root cause of anxiety during the exams. When the students start thinking like, oh, मेरे को तो ये option नहीं दिया, so now there is a problem. Never, the examiners have never formed any opinion of any student. Like Madam has already told, the examiners are there only to see that you know the basics right and how you can go through. Even many of the students who have gone through the exams would notice that many of the times, if you don't know the answers, even the examiners go ahead and tell you about it, because it is all a learning process. So thinking that just because I have not answered correctly or trying to interpret what one has done would make you more anxious. So it is important on focusing on your performance. Let the examiners assess you, not yourself. Because most of the times I make it a point to call the students and ask them to rate their performance, and they hardly rate more than 40%. So even that self rating, you have to have that confidence during the exams, right?
So
Yeah,
that
so
also,
sorry,
go ahead.
Romesh has asked a question. Should an examiner be big-hearted to give out marks, full marks, when a student performs perfectly? There's nothing that prevents an examiner from giving full marks or 0 marks. But one usually tends to stay within what is the parameters for which you are assessing, because we all have parameters for assessment. So if for you to have got full marks, you will take you from a level of what was the perfect answer for that to now to a higher level, to a higher level, and to a higher level. Just doing the average thing perfectly will not give you full marks. Average thing doing perfectly will give you good marks. If we feel that you're good, then we'll check for excellence. If we think you're excellent, we'll go for perfection. And honestly, it doesn't happen to many, or it happens very, very rarely. So let's be true to that also. Should we? And remember, there are 4 examiners. Every examiner may have a little different benchmark as what is perfect and what is not. So that little variability is there. And because we know that there is variability, MUHS and the university says there should be 4 examiners so that the validity of the exam increases. You've got 4 people who may have little differences, who have been trained and who have been given the brief, but yet little variability is there. So the total average will be more valid. Okay.
Right. So that also makes me think sometimes, you come out of the exam. I mean, you finish one part and then you go and then there are all of the other students like, "Tujhe kya pucha? What did they ask you? What was the question?" And that makes you very anxious. Or so is that I know it's very natural for the other students to go and ask, "What did they ask you?" But and then if you don't know those answers and then you get very tensed about it. So I don't know. I just it's a very personal question. Should the students do that? That go and ask immediately. What did they ask you? Because that can be distressing for you immediately, and that can probably affect your performance there as well.
I think during the exams, there are what you are asking, Prajakta, is the exam going. The other exam going students who may ask you
Sir,
about.
you are not audible.
Let me check. Yeah. Hello.
Yes, yes.
So what I think is, Prajakta, there are two set of answers here. One is for the exam going students asking the other student who has finished the exam or the viva on what he or she was asked. And I think nowadays with at least 3 or 4 exam going students, they are hardly having the time to ask this. The second is, I am sure everybody would have this experience, but even most of the exams, when we see the exam experts, who are second year students sitting inside, and if by mistake the exam going students is asking them, they would say, "अरे यार इसको तो इतना भी नहीं आया," because they feel ये सब आंसर मेरे को आते हैं. Because that is what happens during the exam anxiety. So yes, sometimes that can make you anxious, but the set of questions are always or mostly going to be different depending on how the student is presenting and narrating. And just I'll take an extra leverage to say that students have a tendency to pause when they feel that they have missed something in the history or they have not presented it correctly, or maybe the examiner is going to ask a question at this time. So that's not a very good habit. Let the examiner ask you to pause and then a question can be asked. That would be a better way of handling things. Yes, madam.
Yeah, I mean, I think everybody asks, what did they ask you? But if you're the kind who's going to provoke anxiety, don't ask. Because honestly, we don't repeat questions. We may repeat category of questions and the same level of difficulty. See, each examiner knows that it should be fair to all. So we will try to ask the same level of difficulty to everybody. Plus, we may ask that if that person has presented schizophrenia and has already presented management of schizophrenia, I would prefer that he doesn't pick up a drug, antipsychotic, and pick up another drug. So even if he has picked up an antipsychotic, I may say, okay, now pick up another one. So you see, we are looking at it from different angles. So just knowing the questions out there doesn't mean anything. It's not necessarily going to give you an edge. It may just increase your anxiety. So it's better to just stay calm and cool. I'd like to answer one more question which Anuja has put up, because she says, what are we supposed to about thesis? 20-mark category this year. How should we prepare for that? Well, I think most of you all have forgotten your thesis by now. So what were your aims? What was your methodology? What was the research gap? Why you did it? And what are the highlight of the findings and the implications of it? So that's it. And then examiner may ask anything from there, but it will be related to what your topic is and your methodology. So I don't think anybody expects you to do earth-shattering answers there, but at least be aware what you did. See, people are checking now whether you actually did the thesis or not. You very often could have manipulated it. You could have done many other things. So now MUH is saying, okay, let's question them whether they really did it or not. So if you have done it, I don't think you have any issues to worry about it.
Do they need to know
Yes.
all details, ma'am? Like, the results and like
Most
everything in the
important results, not every detail, not that 14.5 said this and 13.5 said this. No, not necessarily. What were the most important findings and why are they significant? I think that's what's expected.
Just to add to the thesis part, students would then read the thesis and forget about the research paper which they have done. So they should know that it cannot only be restricted to thesis. It can also go ahead to, because that's also part of their curriculum. At least for this batch, there have been 2 research works, either poster or paper or publication, So even the examiner can go to that extent of asking about those. But as madam told, it's only brief. The topic, at least you should know properly, and what were the significant implications of the work done, because work done is to make use of the hours which you have spent to do this work, not that it's just a replication of something which has been done. So that is why it is important. And sometimes it can go into the methodology, but all the postgraduates are now giving the BCBR exam, so they should also be aware about the basic methodology. And IPS of most of the branches, state branches, is taking pains to organize research workshops very regularly, and most of the students should attend them so that they would know these, right?
Right. Ma'am, you were saying something?
Oh, there's some questions. I thought quickly we can
Yeah,
answer them
yeah.
before we go up.
So is it okay to, Dr. Prakash is asking, is it okay to write less in the practical paper because of time? The practical marks is the practical marks only made up of what the examiners give, or is there any percentage of marks allotted to what we are writing in the paper?
We sign those papers before we send it to MUHS and we look at it. We may not give more marks to it, but if you have kept a blank paper, you have not written anything, I cannot sign it and say, okay, this is right and it's going. So just be sensible. You write what is relevant right over there. There may not be separate marks, but it is included in what it is and it has our signatures over there. All 4 examiners sign those papers. So remember that also. There's
Yes.
one more question which I've got personally, so I'm just putting it out. It says regarding treatment, when we asked, oh, how do we justify ourselves, especially if you say olanzapine and risperidone? It doesn't matter what you say. If you have a clinical reasoning for what you are saying, you will be granted the thing. People, as Sir Dr. Sandeep has said, we're looking for clinical reasoning, justification, wisdom, sensibility. If all of that is there, you're not to worry. Yeah, Dr. Sandeep was saying something which I interrupted.
No, it's about what they should write in the paper for presenting the history. See, most of the time the students are reading out from that paper only. But if there is some discrepancy, if something is missed, even by the examiners, to note down, to write down, and if there is nothing written in the paper, it is difficult to support the student. So it is important that the student should write even the briefest possible, no problem. It is not a theory question. But he should be reaching a diagnosis, treatment in whatever he has written. It can be brief, it can be just name of the drug. But at least if all those steps are covered, it becomes easier for us to just sign that paper as madam told. And yes, about definitely whatever drug you say, you have to defend it from the literature which you have reviewed during all these years, whatever research you can remember, and support the selection of that drug, and what are the pros and cons of it. You should know the CATI study or the STAR-T study and quote them. They have most of the things written in it. You may not have to refer to some other paper. And if some other paper is very recent and from your department and you don't know it, then that is not right. Then you are not involved or engaged in the work being done in the department. So those are the simple things which should support you.
Right. Thank you, sir. So can I go on to the next video? We have a couple.
Yes, please.
Yes, yes.
Hello. Good afternoon.
बताओ कौन सा ड्रग
I
पढ़े हो
think,
आप?
I'm so sorry. I'm sorry. This
हाँ,
this
yes.
video.
Yes. Yes.
क्या लगता है स्किज़ोफ्रेनिया है पेशेंट को?
यस सर, यस सर।
मुझे तो लगता है फैक्टिशियस डिसऑर्डर है।
हाँ सर मैम, मेरे को भी लग रहा है कि फैक्टिशियस डिसऑर्डर।
डिल्यूजनल डिसऑर्डर क्यों नहीं हो सकता?
सर बिल्कुल हो सकता है सर, डिल्यूजनल डिसऑर्डर
सभी हो सकता है।
यस सर।
तो इसको ट्रीट ऐसे करते हैं कि मेडिकेशंस देते ही नहीं है और कुछ दिन ऑब्जर्व करते हैं।
यस सर, वो मुझे भी लग रहा है, ऑब्जर्व करते हैं।
एग्रेसिव हो गया तो फिर
सर वो इंजेक्शन सेरेनस फिनार्गन सर दे सकते हैं सर।
ठीक है, you can go.
थैंक यू।
थैंक यू, थैंक यू।
Right. I don't know if it was completely audible, but the examiners are trying in this. The examiners are trying to counter question them. Oh, counter question them. Oh, maybe can it be factitious disorder? Can it be schizophrenia? Can it be delusional disorder? And the student is agreeing to everything. Yes, I think it might be factitious, or I think it might be delusional. I think so. That happens often, that it's not that the examiner wants to confuse you, but that does happen, right? In when the examiners are trying to ask you, why don't you think it is this? So how do the students deal with that?
Yes, Dr. Sandeep.
Yeah. Students have to remember that they are not here to please anyone. And the examiners are trying to probe into your, again, as I told you, into your critical thinking. So you have to defend what you have diagnosed. That is the first and foremost. And I am sure before the video, the student must have at least put one diagnosis, and then the examiner has suggested that could it be schizophrenia. Now, if you say yes to schizophrenia, and if the other examiner is talking of it can be factitious disorder, then you have to say that no, it is not factitious disorder because of the following reasons. That would be a correct way of countering and representing your viewpoint. Or if you during that point of time have felt, oh, it can be this, then you have to again put up the arguments on why it can be that and not the other one. So that is very important. And when you are talking of three very different diagnoses, in three very different not possible domains where these three can be the differential diagnosis, then it is a difficult moment for the examiner to justify that you know the things correctly. So make it a point to not give such reasons to the examiners, so that they also have a problem in giving you marks. Forget about the more marks which somebody was mentioning in the initial period, but at least the passing marks, right?
And I think you have to realize sometimes they want to know how you think. The most important, as Sri Lakshmi has also said earlier, is we want to see how you think. Because we know that one case cannot tell everything about a person. But does he or she know how to think through problems, clinical problems? What are they doing? How do they approach it? So when somebody is saying, could it be this? They want you to tell why it could be and why it could not be. So, and whether you can think it through and have you thought it through and why you said this. So if you can demonstrate that, then that's very good.
Yeah.
Let's
क्या लगता है?
the next video maybe. This is again about picking up cues from the examiner, because the examiners are trying to help out. There are times that the students feel, oh, the examiner is going trying to get at me or whatever. So it is important that I feel the examiners are trying to help you out in the exam as well, and it's important how do you pick up these cues from the examiner. So let me play this video.
तो बेटा क्या देंगे आप आपके पेशेंट को?
मैम इस केस के लिए मैं ओलैंजापिन देना चाहूंगा मैम।
श्योर है बेटा?
यस मैम 100% श्योर।
लेकिन आपका पेशेंट तो आपने बताया डायबिटिक है।
यस मैम डायबिटिक है, पर मैम मैंने पढ़ा हुआ है कि ओलैंजापिन सेफेस्ट है, कोई कॉन्ट्राइंडिकेटेड नहीं है।
कितने परसेंट पेशेंट्स को डायबिटीज होता है जो ओलैंजापिन पे रहते हैं?
सर परसेंटेज एक्चुअली मुझे नहीं पता, बट सर मैंने पढ़ा हुआ है बुक में और नेट पे भी मैंने पढ़ा है कि ओलैंजापिन इज सेफेस्ट, उसका कोई कॉन्ट्राइंडिकेशन नहीं है।
कहाँ पढ़ा है? कौन से बुक्स में पढ़ा है?
मैम बुक में पढ़ा है, मेरे को बुक का नाम याद नहीं आ रहा है, आई एम सॉरी, बट पढ़ा है मैम मैंने। आई एम 100% श्योर कि ओलैंजापिन देना चाहिए।
ठीक है, आप कह रहे हैं बेटा, लेकिन कोई ऑप्शन अगर आपको दे कि कोई और ड्रग आप चूज कर सकते हो तो क्या देंगे?
नहीं मैम कोई ऑप्शन नहीं, ओलैंजापिन इज द बेस्ट एंड सेफेस्ट मैम फॉर दिस पेशेंट।
कोई दूसरा ऑप्शन सोच लो एक बार।
नहीं मैम ऑप्शन नहीं, आई एम 100% श्योर ओलैंजापिन बेस्ट है मैम।
फिर भी सेकंड चांस अगर
नहीं मैम सर ओलैंजापिन सर।
ठीक है, थैंक यू।
This is the exact opposite of an anxious student, that you want to stick to your answer, but yeah, I mean, maybe sir and ma'am can say more about it.
I mean, they're giving you clues. Don't be so obtuse, right? Don't be so. I mean, 4 of the people are giving you. Why are you trying to prove the examiner is not right? Don't stick. If you're not sure, you say you're not sure. And I mean, where have you read that olanzapine? I mean, you think about it. If you're not sure, don't make up and guess so much, or don't be um, so rigid in your thinking. I mean, pick up cues. Always examiners understand that you're anxious. Maybe you're getting confused, so they try and give you a cue. How many diabetics did you give it? No, I didn't give it in any, and that should make you realize, okay, olanzapine is not the right choice. But what did you try to do? Try to prove that you were right. It's not a battle. Exam is not a battle. It's not between I proved it to the examiner or the examiners cowed down before me. It's not a battle. We're all facilitating that patients get good treatment when you go out. And for that, what you expected to know is what we want you to know. Yeah, Dr. Sandeep.
Yeah, you saw that in the examination, and all of the students present here know about olanzapine and diabetes, right? But what happens that at that point, if you get stuck and if you have talked about giving olanzapine, fine, you take the next cue from the examiner who told that okay, if you given a chance, you would give something else, and there is always something else. Similarly, even in a diagnosis, given a chance, you have to put a second diagnosis, which is always possible, which you may have missed because a third person looking at the history, similarly, a third person looking at a treatment with more experience is always going to talk of other drugs. So you should be receptive to it. Fine, I think that yes, olanzapine was chosen as a safe drug, but I can also use this drug. Would have been easier rather than getting into a tangle, because then in no way that those answers are correct from an examination view. So it becomes difficult then. How do you give marks on this kind of presentation in a drug? It becomes very difficult. So this is where you should not get stuck, right?
I'm just taking up one more question, Prajakta. It says, guide us regarding neuro. I think this seems to be a bare bone for some people. Neuro history is very vast in a textbook and many details are required. So how much percentage is expected in a neuro long case? So we expect that every person who becomes a psychiatrist can do, first of all, take a neurology examination to rule out common things which could be there. Like I said, common cases that you get would be stroke, hemiparesis, paraparesis, neuropathy, movement disorders, TD. Those are the common kind of cases that we will give you. So how do you take a history for that? And how do you do physical examination? Forget the diagnosis. Sometimes whether the exam is there, they don't find cases. They have only complex cases. Then we are not going to bother about the history, but we are going to see whether you ask some of the relevant questions and whether you can do a good examination. I mean, that is the core of it, being able to do a good examination and make some meaning out of that examination is what's important.
Yes, go ahead.
Can finish the last video and then we can take up the questions in the chat box. Oh, sorry. This was the last video. All right. So I think we have a couple more questions. Someone's asked, in psychotherapy management, enumerating the names is enough, or do we need to?
Prajakta, we can show the first video. First video was not played. The first one.
Right. 1 second.
Because that is most common scenario, I would say. Yes, yes.
Presenting a case of a 21-year-old female, male, Raju, who has come to the OPD. Relax हो जाओ.
रिलैक्स हो जाओ, रिलैक्स हो जाओ. ठीक है बेटा, ऐसा करो, तुम 5 मिनट थोड़ा रेस्ट करो, रिलैक्स करते हैं, उसके बाद
Right. If I think we had a discussion about this, that in
Yes.
case the examiner, I mean the examinee gets a little anxious about something. So and maybe the examiner may say that, okay, you step out, like, relax and then come back. Is that a very bad thing if your examiner says that to you?
Of course not. The examiner is trying to put you at ease. The examiner is trying to help you deal with your anxiety, give you a few moments, and then restart. We are not going to cut on times. We are not going to penalize you here. We are not here to penalize you for everything. But we want that you should be able to give your best, whatever you have done during all these years, and train for it, and not the anxiety overwhelm you and then have problems in your presentation. We have seen students who could not speak, who just became blank, who even could not read from the history they had written. So they need some time. They can have a glass of water, sit outside. We are ready to wait. So if the examiner has suggested that, you should take that cue, and you should try and relax for some time and come back again. There is no problem, and there is no marks cutting because of that. Madam, you can add something.
Yeah, nobody's going to penalize you for being anxious. We are psychiatrists after all, right? We're all in it together. So I don't think you have to worry about anxiety.
Maybe we can take the few more questions from the chat box.
Yes.
What is psychodynamic formulation, Samad? How is it different from diagnostic formulation? I think that's a very basic question, but ma'am, can you?
Yeah. So we don't want a psychodynamic formulation, okay? We want a psychodiagnostic formulation. So even when we are saying, we usually mean a diagnostic formulation. We are not going to psychodynamics. Nobody is going to ask you psychodynamics. Very few examiners who are yet going to ask about psychodynamics, they will ask basics. Nobody is going to ask you psychodynamic formulation, all right? They're going to ask you for a diagnostic formulations, which can include clinical terms, which can use symptoms, which can use signs, which can use predisposing, your 5 Ps over there, and you present that. So that is what is expected of you.
Yes. You should be able to differentiate between a summary and a diagnostic formulation is more important than a psychodiagnostic formulation, because we are basically looking at psychiatric diagnosis, how you have reached to that diagnosis, therefore the diagnostic formulations.
Right. So Dr. Ispita is asking that when we are given a particular legal act or a test or an EG or an MRI and asked to speak about it, what all headings should we speak under?
You have a limited time. You have to read. It's not going to be a very open-ended question. When you are given a CT scan or an MRI plate to read, then you have to first try and see and talk about the basics. What kind of image is that, whether there is contrast or non-contrast, whether there are flare, whether it is T1, T2, whether there is inverted image. And then if you have seen anything abnormal in the plate, then you have to try and talk about it. At least you can talk about the area, you can talk whether it is showing a hemorrhage, it's showing an infarct, how you are differentiating between these things is what would be sufficient. No, you should be able to pick up things from the plate. As far as a legal things are concerned, yes, you will have to apply your knowledge of the Mental Health Care Act 2017, how currently it is being applicable, what you are doing in your department, and because tomorrow you may go out and start practicing psychiatry, have a nursing home, how you are going to follow those rules is what we are trying to talk about when we are talking of these things.
Very true. And I think another important thing is that whenever you're given something, like pick up a drug, you tell us what is a chemical formulation, where is it used, what are the common side effects, what are the things clinically you have to worry about when you're using it, or simple things like that. And invariably, before you even finish that much, the examiner will start asking you more.
Hmm.
Just given you that lead to pick up and try to decrease your anxiety. From there, the examiner can go anywhere. How smart you are in leading the examiner is the art of students. Believe me, how you present the history, how you answers elicits more questions. So if you start talking about esoteric things, then we will question you on esoteric things and then you're stuck. If you start talking about things which are common and which you know, we will ask you there. You have to lead us to what you know. It's up to you.
Dr. Sachin is
Great.
asking, when we are quoting guidelines in for every management steps, is it necessary, or we can answer what we practice in our own institute?
See, practicing in your own institute, answer is not the correct one because you may not be using the right kind of medication as per the guideline. Meaning, there are so many different combinations which you are used to prescribing when you are practicing in your institute. Similarly, you are talking of monotherapy and polytherapy. Polypharmacy is questionable when you are talking of guidelines. So, we need to know from the students that it is not necessary that for every medicine you quote a different guideline. You may have read one guideline, and for all the treatments you can quote one guideline. And it is always nice to know if somebody is quoting the guidelines from the Indian Psychiatric Society practice guidelines, which have been published regularly. So it's easier because it's in the Indian perspective. If you talk of starting in a schizophrenia patient who is 50 kilograms in weight and starting 600 milligrams of clozapine on day one, then whatever guideline you are referring to doesn't work. So important is how you have reached to that, trying to start that drug, and then when you are asked about a guideline, you can tell, okay, this is the guideline which says that in first episode, in so and so things, this would be the first drug of choice, say typical antipsychotic. In that case, I choose this drug because of this reason. That's an easier way of handling that question.
I may also draw to the fact that two of the examiners are internal examiners. If you say that this is what we normally follow, your two internal examiners will support you if that is the truth. But the thing is, if you hide behind that कि हमारे यहाँ ऐसा होता है और वो guideline है, then there is a problem. So there will be two internal examiners, and they will say yes, because see, very often it happens, like say in our hospital, some drugs are free, so they are being used more often than that. So then you'll say, no, we usually start with that because it's freely available. And if I'm an external examiner, that's okay. But suppose you got all drugs, what would you use? So, we also realize that your first drug of choice has been X because X is freely available. But now we are telling you all drugs are freely available. What will you choose? Then we go beyond that. So it's not that we cut you down and say that's wrong. And your two internal examiners will support you if that's what's happening over there, because it reflects what they're doing also.
I think Harshit has asked that while asking about management, should we begin by telling the drug names that can be given in that particular patient and then come back to the most appropriate one considering the individual patient profile, or directly answer with the ideal most drug and wait for the examiner to ask the reason for selection? Is that a rude thing to explain more than asked?
See, when we are talking of any management, and if this is with the perspective of the case you have presented, the examiner is expecting you to respond with respect to the case you are presenting, not a hypothetical situation. Because you have presented a case, you have made a diagnosis, and now you are talking of a drug which should be best treatment for the patient sitting across you. And there comes in everything, why you have selected the drug, what are the reasons for selecting a drug. And then you can always have a second drug. Suppose the person doesn't tolerate, suppose the person suddenly becomes round because of the obesity or the weight gain, then there are chances that you may change the drug, or the person doesn't respond. And what is a good time to see that the person will respond? So those are the things which are important, right?
Remember, this is a practical examination. Theory नहीं है. 10 ड्रग बोल के क्या फायदा? इसको क्या देंगे? इसको जो तुम्हारे सामने बैठा है, इसको ये डिजीज है, इसकी ये मेडिकल कोमोर्बिडिटी है, इसका ये सोशो इकोनॉमिक स्टेटस है, वो इस शहर में रहता है, तो क्या देंगे? It has to be relevant. We want you to apply knowledge, not tell us knowledge.
Great.
So, I think the last question, yeah. Could you please share some tips to approach child cases in the exam, and how much time should we present? How much should we present in the limited time?
I think students should not, sorry, madam. I think students should not become very anxious with respect to the time that they have to do everything within this given time. Even examiners are mindful about it. So many a times you are asked to just elicit the case in front of the examiner and give an adequate time. And the discussion may go on during that, eliciting the symptoms which are present in the child. But yes, even if you are given 8 to 15 minutes, they will still be sufficient for the presentation, for reaching a diagnosis, for talking about the drug treatment, and for some part of the viva. Everything is sufficient even in 8 to 10 minutes. So don't worry about the time. You will be asked with respect to whatever time you are given. We are not going to ask you all the long case history when you are presenting a short case, right?
Yep, I agree. We will actually tell you a brief. Look at the child and tell us what it is. Or
Hmm.
give you a brief, psychoeducate the mother about something. So we will give you a brief and we expect you to do that. We don't expect you to do Herculean things over there.
Someone has asked, will spontaneous humor be appreciated from the student, or is it a bad idea to be humorous during the examination?
Not at all. We appreciate things as long as your body language is telling us that you're enjoying it and you're not acting over smart. That's all.
I think here there will be some concern because we are all in for any good humorous tips, but if they are coming in the correct line, you know this is an examination which you are appearing for after 5.5 to 6 years of your MBBS and 3 years of your postgraduate training. So it means a lot to anybody who is giving that exam, right? And that impression has to be there. Even sometimes answering a question which is very wrong answer, and still the attitude is very casual, it doesn't send out the right signals. So I think the student should focus on being straightforward and carrying the right kind of attitude in the examination, rather than thinking of how he or she can be more humorous, because those may not give marks, but the right answers will give you more marks, so that's important.
I think last couple of questions. Someone's asked suggestion about reading for OSCE and DNB exam.
So
Madam, yeah.
even DNB examination OSCEs is basically to look at skills. So they're going to look at skills. So there will be, different things put over there. There may be a patient and elicit something, or it may be read a report and talk about, answer that question. So I think the same way that you do for MD, the same things are important for that, being able to elicit and demonstrate. And there it is time bound, so you have to be conscious of that also. And that's the only thing that is there, and presence of mind.
Yeah, I think, and in OSCEs they have it in a very structured way, right? Even if we put an OSCE question, then we have 5 questions or 10 questions, and they are easily answerable in the time bound manner, and they are in a sequence, starting from eliciting the history or giving the history, then interpreting it to the management. So it's easier in the OSCEs because they are in a very structured way, and you get marked on all the points. So even if you have not been able to answer one or two, that is fine. The rest of the questions will still be marked. And there are very good books available for reading about the OSCE. So that you should do. But DNB students will also have a way of reading for the theory exams, because they have 10 mark short notes, 10 mark short notes. So they cover a lot of topics when you have 10 questions in each paper compared to the theory exams in the MD, right?
Dr. Anuja is asking, when asked definitions, which source should we answer from? For example, delusions, hallucinations, because all different sources have different definitions.
I think one of the basics, there were two things. One is that some classic definitions which are given in fish have been used by years and years and years for examiners. So those things, that doesn't really change much. But even if you use a little different one and you support it, examiners now are knowing all of that. The third thing is the format of MSc also. I think IPS has shared the South Zone ka collection. So that is something IPS is shared. So moment you say IPS is doing this, and no matter which part of the country the examiner is coming from, they're supposed to know and follow that. So I think those are your strongest backbones. That's why quoting IPS makes you the safest.
But whatever you answer, see that you have answered a definition from the source which you have quoted, because even the examiners would be reading so many books, and see to it that you are trying to answer the definitions of the basic points very correctly, because that's very important. That is where the uh, fine tuning of the symptoms can be done when you answer those correctly. So whatever source you have read from, quote it, no problem. Defend it, no problem. Just see that you are defending the right way. That's what is important.
I think we have overshooted time, and
Too much.
questions, yeah, questions may keep coming, but I think if you both can share some last words before we finish this. Ma'am, can you?
Best of luck. For all the exam goers, best of luck. Remember, we are there to see what you know and what you don't know. Go with that attitude, and it'll be wonderful for you and for us in the examination. And for all the others who are in first year and second year, work on this now. All right?
Yes.
Sandeep, sir?
Yeah, you should not take it as a burden. The examination, you should sit back, relax, and try to reproduce in the correct way whatever your training has taught you for all these 3 years, because it also tells us that you have been sincerely working in the wards. So all those things will also matter apart from your performance on that day. So don't worry, we are there to rate you for everything and not only your mistakes. So see that you are trying to talk of most of the things in the right way, carry yourself well, dress up yourself well. See that this is the figure which is going to go out tomorrow and start practicing or be an individual consultant. So that is what we are looking at when we are trying to rate a student in an examination, right? So best of luck to everyone. Exams are approaching in January. I think most of the exams would be getting over in January. So I hope we have been able to contribute to your preparations in a positive way with this program, right? Thank you.
And can I just add, thank you, Sushil, for organizing this program. Coordinating for the actors for doing that over there. Thank you for inviting Sandeep and me. And we've been co-examiners very often.
Yes.
Understanding also.
Yes. Thank you. Thank you, Sushil bhai. Yeah.
Yes, yes.
Sir, Sushil, sir, would you like to say
Yes,
something?
yes. Very briefly, I'll tell. First of all, thank you, Henal ma'am and Sandeep sir, for sparing your time on Sunday morning. Apologies to your spouses. Second important thing, this particular session has broken all the records of Scholarly
Mhm.
Sunday program. The attendance was 195. So
Wow.
imagine 195 students have joined this program. Third important, all those actors were my residents, lecturers, and senior residents. So I want you all to appreciate them. They have acted so well and they have taken pains to put it down everything in the direction, content, and the acting. Last thing, I have just communicated with MUHS Nashik. So this year, in Maharashtra at least, I am aware that there won't be any auscultations for this batch. From the next batch, we may have a practical examination using OSCE stations. So for this batch, it would be like the last batch. So thank you so much. And I hand over to the Prajakta for the last proceedings.
Thank you so much, sir. Thank you, Hinal ma'am. Thank you, Sandeep sir, for taking out time on this Sunday. And I agree with sir. I think this is the maximum attendance that we've had we had 195 people who had joined in, and I'm sure it was very helpful. Everyone has been messaging. It was really helpful. It was a very nice session. So thank you so much, everyone. All the best for everyone for their exams, and Happy New Year. We'll put posts about the next upcoming things on the group. And yeah,